This is all strictly routine, as far as I can see. They're a nice young couple, newly arrived here in the United States. She doesn't speak much English, but the husband seems to be doing a good job translating my instructions, which I've provided in writing. An ultrasound shows she's further along than originally thought. June 23rd is her due date. She'll need to come back and see me within a week if she hasn't gone into labor. I write out the visit ticket and wish them good luck. Yes, everything's going to be just fine.
OB Clinic, can you hold, please? OB Clinic, can you hold, please?
Hi.
I'm sorry, Mr. Romanoff. Romanoff, sorry. The earliest appointment I have with Dr. Baxter is for July 12th at 2 p.m.
No, that's too long. The doctor say 1 week.
Excuse me, I'm here to see Carol James.
Is she a patient or a staff member?
She just had a baby.
Okay, you'll have to go down to the 5th floor. I'm afraid there is no mistake. That's the earliest appointment I have with Dr. Baxter, and her nurse practitioner is on vacation.
But the doctor said...
Let me try her nurse practitioner and see if she can squeeze you in.
Okay.
I can't get through to her. I'll try her again later. Just to be on the safe side, why don't we book you for the 12th?
No, that's too long. I need to get in earlier.
I'd really like to help you, Mr. Romanoff, but I'm afraid that there just isn't a more available appointment.
Tudom, hogy a doktor ezt meg... Tudom, hogy ezt mondtuk, megmondom nekik. Okay, the 12th.
Super. You are all set then. We will see you then.
It's fine.
OB Clinic, can you hold, please?
Yes, in 3. Thank you.
So you got something for me?
Yeah, I got another one for you. Here you go.
Great, thanks. What a zoo. I've got one woman with severe asthma, a rule-out preterm labor, and an ambulance with a bleeding previa on the way. The docs have been scrubbed all night, and these patients keep rolling in.
Jane.
Oh well, the beat goes on.
Yes, in 4. Thank you.
My wife, she has a pain.
Dr. Baxter.
OB reception. Can you hold, please? I need your card.
A card?
Dr. Baxter.
I need your blue card. That's what I need for the check-in.
Fine.
I don't have the blue one. I have these other cards.
I need the blue.
Dr. Baxter.
Is your wife in labor? Is your wife having contractions?
No. Pain in back pain here.
Okay, why don't you go take a seat in the waiting area, and I'll have the nurse come talk to you as soon as I locate your records, okay? And while you're waiting, can you fill this out?
Where is the waiting area?
You can't see it from here, but it's around the corner, and it's down the hall a bit.
How long is wait? She needs help.
For the reception, it shouldn't be very long. That's in Unit 3. Yes, thank you.
When it rains, it pours. This woman's chart says she's 39 weeks, but I see a note of an ultrasound that says 42. There's some bloody show, but her cervix is long, thick, and closed, and the head is sky high. Contractions are irregular. If I understand them correctly, and I'm not sure I do, the patient reports decreased fetal movement for 2 days. God, where's that interpreter? And there's this. These sounds.
This house? What is this house?
Dr. Baxter! No, let's just try to stay calm now. The doctor is in surgery, and we'll be here as soon as she can be, okay?
But what is this house?
The deceleration of the baby's heartbeat. It doesn't mean that there's any...
It's a heartbeat. Is baby okay?
Yes, fine.
The doctor called about that patient in 2. What do you want me to tell him?
Okay, give me a minute. I'll be right there.
It's important.
Yeah, okay. I'll need a minute here.
I need to talk to Dr. Baxter now. What is happening?
Mr. Romanoff, the best thing for you, your wife, and your baby right now is to calm down. Okay? Everything will be fine.
Your asthma patient needs help.
Okay, I'll be right there. Mr. Romanoff, just as a precaution, I'm going to move your wife up to labor and delivery so the doctor up there can see her, okay?
But I need...
No, it's okay. No.
What she needs...
I know.
No, doctora, problema.
I'm so hungry I can't think straight. I've been on since 3:30 without a break, and here I'm being assigned another patient. Where is everybody tonight? I can't believe I'm doing a double.
I'm right there. I gotta fill Betty in on this case. Bye. So how are you tonight?
Well, I still have a patient I need to move to postpartum, and I haven't had a chance
Okay,
to...
well, first you need to see this patient. She may be 39 weeks. She could be 42. My exam indicated some bloody show, long closed cervix, no contractions. There's some D cells on the monitor.
Betty, did you happen to see that patient in room 2? She was complaining of abdominal pain.
Yeah, she's been taken care of. Thanks.
And as far as I can understand these people, there may have been some decreased fetal movement over the past couple days.
I need you.
Yeah.
Do you mind if I take a
I've got to
short
go.
break to eat?
I'm sorry.
Where is the doctor? My wife, she needs a doctor now, please.
Just try to stay calm. The doctor will see you as soon as he's available, okay?
Is the baby okay?
Mrs. Romanoff, are you feeling any contractions? Mrs. Romanoff, I'm going to have to ask you to lay back and be still. Lay back and be still, because when you move, it affects the monitor, okay?
My wife, she does not eat, she does not drink. So, what's going on with the baby? I need a doctor right now, so can you please?
Mr. Romanoff, I'm going to have to ask you to give me one moment, and I'll bring someone in who can help you, but I just need one moment, okay? Okay, breathe, breathe. Good. Could you take over this case?
I'm happy to fill in for her. God knows there's plenty of time someone else has done it for me. Anyway, Betty explains what's going on with the patient. Possible D-cells. No dilation, some show. I'll take it from here. I just wish I had the time to track down those test results for Dr. Robinson. But I'll get to it somehow.
Now what's going on? Where's the doctor?
He'll be here just as soon as he's out of surgery. But I'm going to take care of you, all right?
Is baby all right?
Everything's fine, just fine. Okay. Now, I need you to lay on your side. Can you do that for me? Can you lay on your side? Good. That's it. I'm going to start an IV. Great. You're doing just fine. You're doing just fine. Now, you're going to feel a little prick here.
What are you doing to her?
I need to find a vein. Now, just try to relax. Everything's just fine.
Ariana, my darling. Hey, it's okay, it's okay. Trust me. Trust me, everything will be just fine.
Okay, I'm going to try another area. Mrs. Romanoff, the more upset you are, the harder this becomes. So I really need you to calm down. Just try and relax so I can find a vein. Good.
Uh-oh, looks like Patricia could use a hand here.
Okay. I'm going to give you a little break here. I'll be right back.
She gives me a quick update. No luck with the IV. The patient must be dehydrated. The husband says his wife isn't having contractions, though it's clear the woman is in pain. No sign of labor. The strip shows a flattened baseline. The baby could be sleeping. I'll see if I can get this IV going. Then I'll just have to keep an eye on things. I'm going to try to get the IV going for you, okay? We have the asthma under control for now.
Any signs of labor?
Her contractions are about 6 minutes apart, and... where's the resident?
He's in surgery. He should be about done now. It was just a routine.
That's 4. I'm going to set a personal record here if this keeps up.
Dr. Feldman, I think you should take a look at Mrs. Romanoff.
What?
Well,
Doctor, the patient in 3 is almost crowning.
I'll be right there.
it's Mrs. Romanoff. I have some concerns. She's had some questionable D cells, and would you mind taking a quick look at her?
Doctor, the woman in 4 is complaining of severe pelvic pressure.
1 second. Listen, I've been up for 24 hours. I got a lot going on. Let's let Joni take care of it.
Joni's a med student. This is something I think that...
Joni is perfectly capable of handling this.
I have nothing against Joni, but I really think that...
this baby.
Excuse me.
Dr. Feldman must really trust my opinion. I wonder if he'll give me a letter of recommendation. Page Dr. Feldman immediately.
Mr. Romanoff, you're going to have to wait here. Your wife is going to have a C-section.
A what?
An operation to remove the baby. You're going to have to wait here.
Did somebody call Pete's?
Itt vagyok, minden rendben lesz, várok rá.
Another rush section. Why don't they ever anticipate this stuff? Her airway is class 2, weight 137 pounds. We're proceeding with a spinal.
Dr. Beckett?
Working on it.
The patient showed a possible abruption.
Thanks, got it. I'll take it from here, Doctor.
I just wanted to show you some of
I've
the things that
reviewed the
have been
case,
going on.
Doctor. So why don't we all just do our jobs and we can get this done?
It's okay. Just try to relax. I'm here for you, Ariana. It's okay. Just try to relax. I'm here for you, Ariana.
Okay, people, what's the story? We need to operate here.
The spinal doesn't seem to be working, but I'd like to give it a few more minutes.
There's no time. Let's proceed with general anesthesia.
I'd like to double-check her airway first. She's class 2, but...
You're not listening to me. The last strip showed D cells and bradycardia. We've got to get this baby out stat.
I just need a few minutes.
We don't have a few minutes. Get on with it.
It's okay.
Now, Doctor. Okay, everybody's ready. She out yet?
She's asleep, but I still need to intubate.
All right, then we're going ahead.
Shouldn't we wait for the airway?
We have incision.
We have incision at 12:25.
Her jaw is not opening well. I can't intubate.
Go first.
I can't ventilate. We need a surgical airway. Call for a code.
What's wrong with you people? This is not looking good.
Call for a code!
Calling the code team.
Where's the C-section room? You just passed it.
I'm down to the uterus. This blood is looking really dark. Please tell me you can oxygenate this woman.
Pediatrics is here.
Oh, that's great. Where the hell is the code team?
We're here.
It's about time.
Didn't find
You
you.
need an emergency trach.
Okay, people, we have a baby boy.
This baby needs resuscitating right away.
I'm on it.
I'm seeing a lot of blood.
I think it's working. He's breathing. Heart rate
110.
So far, so good.
The mother's O2 sat's coming back up.
I want him moved upstairs right away. I have a lot of other things going on. If you can just give him the vitamin K now, and I'll take it from here. I really need to get back to the NICU.
I know. Oh, baby, this is going to hurt a little bit, okay? There we go. Okay.
Okay.
Oh, my God, what have I done?
What happened?
I just gave the baby a shot of methogen.
I'm going to call the pharmacy right away. We'll see what we can do about minimizing the toxicities.
Hurry.
I would have booked an earlier appointment if the computer had let me.
I told him it was a job for a doctor, not a med student.
These nurses are lousy. If they just did their jobs, everything would be fine.
They force cutbacks on us, and then they expect us to work twice
I
as
should have
hard.
looked more carefully. I just don't know if I can do this anymore.
Code team was too slow.
I did everything by the book.
I'm so completely devastated.
Ariana, my darling, it's okay.
I will carry this with me for the rest of my life.
Trust me. Everything will be okay.